Hi, this video is to give you some help in using the softballs and a mat and your breath to help relax tension through the body in areas where we very commonly hold onto tension. And sometimes you find that even if you're not aware of carrying tension in a particular part of your body, when we start to try to systematically relax, you can really find holding in places we didn't know we were doing that. So bear with me here. I'm going to be giving some advice on breathing as well. There's some really good research that shows how controlling the breath in terms of what muscles we're using to breathe and the rate at which we are breathing can really help to change our brain chemistry and down-regulate the sympathetic fight and flight drive in the central nervous system. So the first thing to do is to set your environment. So it can be really helpful to use things like music, if that's something that you find helpful, that you know can help you to relax, if there is music that helps you. Otherwise, silence might be exactly what you need. There is so much out there now on the internet that even bird song or the sound of waves, anything that resonates with you, it can really make a difference to how we start to change our state. So if sound or music is something that you know might be helpful for you, then it's really worth setting the environment with music, also with lighting. So particularly if sleep is an issue with anxiety or stress or just feeling wired, then changing your lighting and doing something like this to relax in the hour or two before you go to bed will make a really big difference. So turning the lights down will actually help to get your hormones to help you get into the state that you wish to achieve. So a quiet room, a mat and props set out so that you feel really comfortable, secure and ready to really change. So it's a really good idea to start with tuning in before we even start with the balls. So get yourself comfortable. I've just got a really soft support behind my head. If you do have neck problems or you don't feel comfortable lying on your back, if your neck tweaks a little bit, then you can, if having a flat, this is a folded blanket, isn't comfortable, then if you just fold it so that a little bit of material comes up to give you neck support, you might find that that makes a really big difference to how comfortable your neck is in a position like this. For many of us, being in a semi-supine position is the most efficient way of relaxing tension through the spine, allowing the pelvis and the belly to relax. But you might not find this comfortable. So what you can do is to have a coffee table or a chair underneath your legs so that you're in this position and can really relax your legs. If you really are more comfortable in a completely prone position, then it's really important that you find the position that's right for you. But for me, and for many of us, I'm going to stick with semi-supine. So before you bring the balls into play, allow yourself to tune into your body. So the drawing in of awareness to the physical sensations of your body is one of the most common ways of calming the nervous system, of getting away from the verbal left brain stimulating state and into the calm parasympathetic rest, repair state. So the first thing to do is just to notice your body. So notice all of the contact points of your body, your feet. You're just feeling the sensation of the balls of your feet. and the heels and areas of the sole of your feet in contact with your mat or your floor. And then the heaviness of the pelvis, just getting the sensation of releasing the bones and seeing if you can melt any tension away, and working your way systematically up the body, seeing if you can sense which parts of your spine are touching the mat, not trying to change anything, just tuning into the feeling of lying on the floor. And little by little, deliberately and systematically releasing tension, giving permission to the body to relax as much as possible. Sometimes that's easier said than done. So you're just seeing what you can release, noticing what you can't, little by little, tuning in so that all of your attention is coming into your body, into the sensations, fully focused on the sensation of being here. Sensing the neck, seeing if you can release the muscles in the neck, just allowing the weight of the head to be supported, which is why it's quite nice to have that extra roll in your towel or your blanket or a neck pillow to support the neck beneath the skull. The next area that we carry a lot of tension in that is useful to tune into before we do anything else is the jaw, the mouth, the tongue. So again, as you've worked your attention up from the feet through the pelvis, the spine, maybe the shoulders, feeling the arms and the hands really relaxed, making sure the fingers are relaxed. Notice your jaw. Sometimes we hold on to the jaw, clench our teeth without noticing. So you might want to stretch your jaw and then relax the tongue. See if you can just let the jaw release. And the brow is another area that we sometimes hold tension in without realizing. So that's a really good way to begin, scanning through the body, whether you've got your legs straight or your legs bent, body scan with your full attention is a really good relaxation method. And then you want to begin to take the attention to the breath. So a really simple way of beginning to down-regulate the sympathetic fight and flight drive is to count the breath. It can be helpful to have your hands on your belly. Your diaphragm wraps around the spine in the middle of your body underneath your lower ribs. So putting your hands on that area can be useful, and just begin to notice your inhale and your exhale, feeling the expansion and contraction around your diaphragm. It can be quite comforting to have the hands on the abdomen anyway. And seeing if you can get the breath centered in this area, just noticing. If you force it too much, we tend to use the muscles to try to get movement in this area, and that's not what we want. We want to try to keep everything relaxed and just notice the diaphragm doing its job. And then beginning to count so that we get the in-breath and the out-breath even. So we can start with a count of 3. So you inhale and literally have the numbers, the names of the numbers in your head. So you're counting inside your head. 1, 2, 3 as you inhale. 1, 2, 3 as you exhale. You might find that's too quick, so you can try 1, 2, 3, 4 as you inhale, exhale, 2, 3, 4. And if you can aim for a couple of minutes to breathe with awareness, making the inhale and the exhale even and slow, smooth and steady. Again, you're taking control of your nervous system and deliberately relaxing and changing your state. If you're particularly wound up, then beginning to lengthen the exhale so that it becomes longer than the inhale once you've started to get a little control over your breath in a body that is relaxed. Can be a really helpful way, again, of down-regulating that stress response. So for example, you might inhale for 4 and begin to exhale for 6. So let's try that. Inhale, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. And you can continue that for your 2 minutes of changing your state, beginning to transition. And if that feels comfortable, you can begin to lengthen the exhale even more. There is a system of breathing to help manage anxiety, which is called 7-11 breathing. Inhaling for 7, exhaling for 11. So that's something else to try. So now that we've spent a few minutes relaxing the body, beginning to change the state, we can focus a little bit more on actually getting deeper into changing the state of the tissue and the condition of the tissue and our subconscious or unconscious holding patterns. So one of the best places to start with the soft balls is to lift your pelvis still in that semi-supine position and just place them either side of the base of your spine. So if I just show you where we're putting the balls. The pelvic bones are here, the ilia come in and curve downwards, and here is your lumbar spine. And then your sacrum is a triangular bone at the base of the spine, and underneath that is your coccyx, which curls under. So you can start by taking the 2 balls and just placing them really at the top of your sacrum, either side of the central part of the bone. And you can keep the neck supported here with the blanket, or you can, if you're more comfortable, take it out. So for me, I'm more comfortable without it. So do whatever's right for you. There's no hard and fast rules. So pressing into your feet, lift your spine, place the balls at the back of your pelvis, and then begin to, just like we did at the very start, allow the weight of your pelvis to sink into the balls. So the thing to do here is get the upper body back and relax, so the arms are out to the side, fingers relaxed. And then see if you can let go of your belly. We often will start to tense up the belly. Let go of your pelvic floor, so even the muscles around your back passage often will carry a lot of tension there. So as we want to release into the balls, release the weight of the pelvis, you're trying to relax all of the pelvic muscles, so around the glutes, the buttock muscles, the lower belly, the pelvic floor. And you'll feel the pressure of the balls, and sometimes it can be a little tender, and that's normal. And again, you want to see if you can work with sinking into the balls for a couple of minutes. So you might take the first minute just to keep sinking. Get control of your breath again, so the nice, steady, even breath. So you're using your diaphragm to breathe. You're trying to keep tension out of your upper body, your shoulders. And then with the second minute of the balls in this position, you can just begin to take the knees from side to side, really slowly. So you don't want to have too much of a dynamic rocking motion. You're keeping everything slow and steady so that the brain has got time to assimilate, to notice, to respond. So you don't need to take your knees too far. What you're doing here is just rotating your spine, your lower spine in particular. And that gives you a little bit of a massage. It helps to change the tone and the sensations in your fascia and your muscles, in the soft tissue. And you might find that, for example, going to one side, there's a kind of sweet spot. It shouldn't be a yucky spot that makes you feel uncomfortable and makes you want to tense up. But if you can feel that you're relaxed, but there's an area that you've got pressure in that feels like it's a good thing, then take a few breaths in that position. Again, all the time trying to soften, trying to release your weight into the balls, trying to keep tension out of your body. And every now and again, you need to keep checking in. Are my shoulders relaxed? Is my jaw relaxed? Is my belly soft? Is the pelvic floor relaxed? Because we will switch them back on without thinking about it. Be patient with that, it's normal. So you're still fully focused on your body, and that makes it really difficult for the monkey brain to keep jumping around. So if you find that your thoughts do start to rev up, keep coming back to the basics of counting your breath, checking in with certain areas, pelvic floor, belly, shoulders, jaw, and seeing if you can soften them again and drawing the attention into the body. Using words like pelvis, breath, the numbers of counting your breath can really help to draw the attention deeply in. If it feels better for you to just stay in one place, keep sinking the weight into the balls, allowing your body just to sink onto them, then don't worry about the movement. And when you've been here for a couple of minutes and that feels good, you feel like everything's switched off, you start to not notice the balls so much, it's time to move. So press into the feet, lift the pelvis and roll the balls up a couple of centimeters so they're just at the base of your spine. And again, adjust everything so the shoulders can relax. And you can begin to release the weight of your body once again into the balls. And it shouldn't be painful. It shouldn't feel that you're tweaking in your low back. If it does, you can try adjusting the position of the ball slightly lower, slightly higher. But many of us can find another comfortable position just slightly higher than the sacrum, either side of the spine. And again, letting the pelvis, the weight of the bones, release into the balls. And then draw the attention back to the breath. Checking in that the belly, the pelvic floor, the jaw, the shoulders, the chest, the brow are relaxed. Take a good minute to release. And then you can just see what it's like to put some movement in, taking the knees from side to side, really slowly, with steadiness, with control. And for me, there's a tender area on the left. So I'm just going to hold it there for a couple of breaths, making sure there's no tension creeping into the body. Till I get a sense that that can relax a little. And either the knees might want to go further, or you might want to come back to the center. So you don't have to put the movement in, but it can be useful to explore. It gives you another sensation for your brain to focus on, and another opportunity to check in with that tension through the areas that are really common for holding to take place. And then you can lift the balls out and let the pelvis come back down. And again, just take a minute or two to feel the difference around the back of the pelvis. You might feel a lot more grounded. Your back might feel released a bit more. And then you can carry on in the same vein, working all the way up either side of the spine. So for me, I have quite a large arch in the back of my, the low back, in the lumbar spine. So I don't want to put the balls right in the middle of that curve. So I'm going to take the balls and put them at the base of my ribs, my thoracic spine. So I'm going to just walk my feet in slightly more so that when I lift and press into my feet, I can lift higher. And I'm rolling the balls around about the base of my ribs, slightly higher than the floating ribs. So if when you come back down, it's uncomfortable, just come up again and take them slightly higher. So you'll find the right place. It feels slightly uncomfortable, but in a tolerable, comfortable way. So again, if I show you, you might find that here where the floating ribs are is not comfortable. So you just roll them up to round about where the base of your shoulder blades are, maybe slightly lower. So the shoulder blades are here, and I want to put my balls here, either side of the spine once again. So you work with what's right for you. It depends where we carry our tension, which vertebra maybe have a little bit of tightness. And if you've got inflammation, for example, in your facet joints, then you're not going to want the pressure there, and it will feel uncomfortable. So just move them elsewhere. You'll find another spot where it does feel good. So for me, this is really comfortable, and the balls are just below the base of my shoulder blades. And what this is doing is this is lifting and flaring my lower anterior ribs, and that gives my diaphragm a little bit more space. So when I come back to breathing, the awareness of the space at the front of the body, the expansion of the diaphragm and the ribs is much more easy to feel. And if you carry a lot of tension in your upper back, this is a really good area to work with. So again, same rules apply. You want the pelvis to relax onto the mat. So you're heavy through the bones of your pelvis. You feel relaxed there. Pelvic floor, belly, relaxing. Buttock muscles releasing. Diaphragm soft. And just enjoy the sensations of spaciousness at the front of your abdomen. If you have a tendency to carry tension through the belly, which many of us do, this is also a really nice sensation of getting space where usually there's tension. So the same rules apply. Check through the areas of your body for tension and check into the breath, beginning to bring the steadiness, the smoothness. And you can again count the inhale, exhale if you have a tendency to hold on to your breath. Softening the body and allowing it to release into the balls. And it'll take a minute or two to really get that sense of softening and releasing into the pressure of the balls. And once again, you can try just taking your knees from side to side. You might find that you've got a bit more movement. You might find it's easier to one side and you run into a little resistance on the other side. So you can try just staying with that resistance, breathing into it, applying all of the rules of trying to release your body into gravity, checking the common areas to see if you can release any tension, and breathing into any areas that feel a bit sticky, a bit uncomfortable. And you tend to, if you can get into that intuitive state, know when it's enough and you can move a little bit more freely. Or you can just stay in the center and work with your breath, just allowing everything to relax. And then I'm just going to roll off the balls so that I can show you. The next area to work with is more the upper back. And if you're really using the balls to change your state and encourage a sense of release through the whole body, then it's really good to work up from the base of the pelvis into the upper back. And with the upper back, especially if you're a shallow breather, if you suffer from anxiety, we tend to breathe into our chest, then coming and taking the balls between the shoulder blades, but the space between where the shoulder blade is and the spine is where you want to aim to put the soft balls. So they're quite close together, but they are either side of the spine. So as we come back, you can roll from one side to another to place the balls in place. Just find whatever makes the most sense. And once we start to have the balls underneath the upper back, sometimes it can make us hyperextend in the neck. So the best thing to do is to grab a brick or a block, or like I've got here, a folded up towel. And I'm actually going to fold it again so that I've got plenty of support for my head and my neck. So again, I can relax my jaw. My neck feels really well supported. And it can be, or they call it all sorts of things like therapeutic pain or therapeutic discomfort or yummy, yucky sensation. If we've got quite a lot of tension in the upper back. So again, just take your time. It's really common to have sensations elsewhere as we breathe more deeply and as we begin to release tension in long held areas of tightness. So the same rules apply: pelvis heavy, belly soft, pelvic floor soft. And seeing if you can allow the body to release and relax into the balls. Breathing really deeply, allowing the arms to really relax, the shoulders to relax. And here with movement, you can try knees side to side, or you can try working with moving the arms. Again, keeping the breath really steady and full and deep. You can try arm circles, you can try flexion and extension, or you can just let your arms relax. And there's probably room here to do one more, but this time a little higher, so towards the top of your shoulder blades. You can take the balls in there. And again, I'm just going to roll from side to side to place the balls either side of my spine. And I'm just going to see how that feels before I decide what I need underneath my head. So again, I'm just going to slide my folded up towel underneath my head for some support underneath my neck. And that feels really comfortable. But here the balls are a little bit higher, so my back can be flatter. I'm letting my belly, my pelvis relax, all the same checkpoints as you move the balls up higher to the top of your thoracic spine. And again, take the time to relax onto the balls first, allowing any tension to soften as much as you can. Jaw, brow, diaphragm, belly, pelvic floor, pelvis. And again, you can use arm movements to give yourself a little bit of a massage, to just see what's there. It helps to keep the brain focused on the body. Or you can just relax. And again, take 2 minutes. And then the last positioning I was going to show you is a little bit of craniosacral work. So what we're going to do is we're going to take one ball and place it at the sacrum, and the other ball is going to go in the nape of the neck. So here is the occipital ridge, where the skull bones begin to curl in, and where the top of your neck vertebra come and support the head. So what happens when we lie on the ball is it will roll into the curve of the neck, and that's not necessarily that comfortable and not quite where we want it. So the best thing to do is to have, you can have a book, you can have maybe a yoga block, or you might be able to fold a blanket or a towel enough that just lifts the ball slightly higher. So just like we did right at the beginning, we're going to come down into semi-supine, lift the pelvis and place this time one ball centrally at the sacrum. And then here we want to adjust the ball and the towel so that I can then rest the head on the ball. And if we carry a lot of tension in the TMJ, the jaw, and in the occiput, which many of us do, this can begin at the start to be a little uncomfortable. It can even make you feel a little bit headachy. So just be gentle. You might find that you want to just focus on the ball at the occiput first, because it might take a little more time to allow the head to relax, the jaw, the brow, the eyes. And it can take a little time for those, for the tissue at the back of the skull to relax. And you should find that the discomfort begins to dissipate as your head starts to sink over the ball. But be patient, it takes a few minutes. So that for me is beginning to release. So now I'm going to place the second ball under the sacrum. And you can adjust it so that you feel stable enough. You might want to take your feet a little wider to be able to relax. So this is a really good way to finish, especially if you're going to go to bed afterwards. Because in releasing both the sacrum and the occiput at the same time, doing everything that we've been working on with tuning into the breath, relaxing the pelvic floor, the pelvis, the belly, the diaphragm, the neck, the jaw, the eyes, the brow, and allowing the body entirely to be supported by the balls and the earth, we can then attain a really deep relaxation state. Focusing on the sensations and giving the body permission to sink into the balls. And you can stay here for as long as feels good. I would say with all of these positions, a minimum of 2 minutes. And I'm going to leave you with that thought. So stay on the balls. Keep your checklists of breath, soft, counting, long exhale, allowing the body to sink. Any questions or queries, please do get in touch. Otherwise, trust your body and you can experiment with the balls. I've got a couple of other videos which work on particular areas, particularly if there's pain, but this is a really good one for relaxing. So good luck and keep in touch. Let me know what you think.